Welcome to this brief overview of evaluation and treatment of infertility. My name is Dr. Rodi, and I'm a reproductive endocrinologist and infertility specialist. Many couples are concerned about what the process of an infertility evaluation involves because they had hoped, of course, that pregnancy would have just happened the old-fashioned way. Actually, it's a good idea to go in to see a physician before you even start trying to have a family, because there are a bunch of tests and parts of your history or physical exam that could be optimized before getting pregnant. For example, if a woman is anemic before she gets pregnant, that can be corrected easily, much more easily than when she's pregnant, where she is feeding two people. The history that we look for before a patient is trying to get pregnant involves, for example, is she having regular periods? Because if she isn't having regular periods, it makes it very unlikely that she will get pregnant in a timely fashion. Or does she have any history of surgery to the abdomen, appendicitis, for example, that might impact her fallopian tubes? And does her husband or male partner have any indication that he might have a problem with his sperm count? So those are all things that are good to know ahead of time. The lab tests include a variety of things that we want to optimize. So as I mentioned, a blood count. We also get a blood type. We also want to know if the woman is immune to certain infectious diseases that are harmful in pregnancy. For example, German measles, chickenpox, and measles. Another type of infectious disease that we're interested in are the ones that are more easily treated in the non-pregnant woman. For example, HIV, hepatitis B, and syphilis. We go on to check for things like prediabetes and other infectious diseases such as gonorrhea and chlamydia. At the same time, we check the woman's ovarian reserve, and we do that by FSH levels, AMH levels, and an ultrasound of the ovaries where we measure the antral follicle count. Once we have all those results and the results of the semen analysis of her male husband, then we can talk about where we might find any challenges or where we think everything is okay. Depending on the patient's, the female patient's age, we will sometimes talk about banking embryos for the future. So many couples today are in their mid-30s before they start considering pregnancy. And certainly by the late 30s and 40s, it might be much more difficult to get pregnant. So banking embryos makes sense. So what are the different areas where we can identify a problem and areas where treatment could be preventative? We want to obtain genetic carrier screening on both partners in order to evaluate for recessive conditions. Now that's kind of like the inheritance of blue eyes. If somebody has brown eyes, we don't know, do they have a brown gene and a blue gene, or do they have two brown genes? But we do know in a blue situation that that person has two blue genes. And with something like cystic fibrosis, the partners don't know they have this mutation, but if they share the mutation, then they have a 1 in 4 chance of having a child with that disease. Further, we can test embryos for these conditions, avoiding a couple having a child with a serious disease. The other kind of genetic screening is for dominant mutations. In that case, the person has the mutation. They just may not know that they have it because they are not old enough to have had the manifestation. And that's an example of those are cancer genes, which means that the person has a higher risk of certain cancers. So at that point, we've gone over the history, the physical exam, and the labs, and everything looks fine. That couple can go ahead and start trying. Or, if they are older, then they may want to undergo in vitro fertilization for embryo banking. On the other hand, if a problem has been found, such as a low sperm count or blocked fallopian tubes, then the recommendation would be to proceed directly to in vitro fertilization. If a couple is going to undergo in vitro fertilization, then the same process which I described in the egg freezing video takes place, which is that the woman takes injectable medications for 9 to 12 days, and we monitor the evolution of the growth of her follicles, where the eggs are, to determine what the best day for administering what we call the trigger shot. Once we give the trigger shot, we do the egg retrieval a day and a half later under anesthesia. Now, many couples are very worried about that aspect of the treatment because it involves anesthesia and it involves a surgical procedure. But this is a very low-risk procedure, and there's a team of doctors and nurses taking care of the patient at every moment. What we do is, under anesthesia, we visualize the ovary with the ultrasound probe, and then we attach a needle to the probe, and under direct ultrasound guidance, we insert the needle into the follicle and aspirate the fluid. That fluid gets handed off to the embryologist who identifies the eggs. They then go on to be fertilized, and the husband or the male partner will have provided a sperm specimen. In the case of donated sperm, it may also be frozen sperm from a bank, and depending on the situation, the insemination is done either by direct injection of the sperm or by putting the sperm and the eggs together in the dish. Then the process of fertilization and growth of the embryo are observed over the next 5 or 6 days. We're looking for embryos that will make it to what we call the blastocyst stage. These embryos have about 100 cells. If the couple has elected to have the embryos biopsied for chromosomal abnormalities, or in the case of recessive mutation, then the biopsy will occur at this time, and then the embryo is frozen. The biopsy specimen will be sent off, and 2 or 3 weeks later, we get a result which includes how many of the embryos appear to be chromosomally normal, and in the case of what we call PGTM, where there's a mutation that we're testing for, how many of those embryos are unaffected, they don't have any mutations, carriers, where they have 1 mutation, or affected, where they have 2 mutations. Once we have those results, we can inform the couple and then make a decision about either doing additional egg retrievals or proceed to transfer. This is a brief overview of the evaluation treatment of infertility. If you have any questions, please reach out to us.